I'm a journalist working in India, and I'm also involved in TB and disability advocacy. I lost my hearing because of an anti-TB drug. I had a very prolonged battle against tuberculosis that started when I was 17.
2007, she had her first bout of intestinal tuberculosis. At that time, medication for 18 months, doctors told us that this disease will never appear again in her life, ever. But suddenly one fine day, the disease appeared again in our life.
So during my second bout of TB that started in 2013, I was given an injection to treat my TB. So in the process of getting cured, the injection has a very damaging side effect that I was not told about, and that was hearing loss.
I will never forget the incident that she explained to me how she lost hearing. She slept with a normal hearing, woke up in 10 minutes with no hearing. In 10 minutes, her entire life changed.
It was just 2 days after her birthday. She just told me that I'll just go to sleep for 15 minutes, let me rest. Then she slept and then she got up. I just called her, Nandita. She didn't reply. I told her, why are you not replying? I'm calling you for such a long time. She said, when did you call me? That's when we realized that she suddenly lost her hearing. 15 minutes before, we were speaking, and 15 minutes later, she had lost her hearing, and it was a sudden hearing loss, it was a profound hearing loss. It was a big shock for the family. The right ear was around 50%, the left ear was straight, and the first go itself, it was 100% hearing loss. But this 50% was continuously increasing. With every visit, with every audiometry test, we found that she was losing more and more of hearing.
So the world around me completely turned silent. I slipped into depression for a very long time. We were exploring different technologies and different options. So we were recommended hearing aids, quite advanced hearing aids as well. But it did not help us. After that, then I read about cochlear implant. We faced a lot of misinformation from a lot of clinicians we visited. More or less everyone told me that it's not going to help you.
And the worst thing what she explained to me was, will I get paralysis after cochlear implant? And I said, no, this is not possible. And she said, some doctors told me that, you will get paralyzed after cochlear implant. That was quite a shocking information for me.
So then we came to Chennai, that is it's a place in southern part of India, and we visited a doctor named Dr. Mohan Kameshwaran. He's one of the most prominent ENT specialists.
That's when I found that children around 1 year, 2 years, 2-year-old children coming for therapy at the center. At that point of time, it was very, very essential that we get our doubts cleared.
So that was kind of revealing for me that, if children aged 1 and 2 can go for this, then definitely I think I have it in me to try this out.
Unless she is confident, it's very difficult for us to proceed as a professional, because any patient with a half mind or fully confident, you will never get a good result, because you always have something in the back of your mind. It's very important to make sure the patients are very, very comfortable and confident in what they're going to get.
And I had my cochlear implant surgery in November 2018, and then it's been a growing trajectory after that. I have to say this, that the cochlear implant has its limitations. Definitely, you will be able to hear some things, you may not be able to hear some things, that is the fact. But definitely your hearing will improve compared to not having any hearing at all.
Having a cochlear implant surgery has been one of the best decisions that we have taken. The first time when she heard the sound and the reaction in her face, I will never forget. Yes, hearing sound after 5 years.
I can actually think of having a personal life, which I thought I would never have at all. This was something that was that I had lost hope about completely. I had thought that I am not destined for such things in life. Now I think that yes, maybe it can be a possibility for me now. Implant helps. Cochlear implant definitely helps in some areas. Some areas, I have to say, you have to keep patience. It's not a process of over 1 or 2 months or even 3 months. It's a process over years. It grows slowly and steadily.
If I have to tell one thing, hearing restoration is possible. Even if you're profoundly deaf, you can still restore hearing. But all that what you need to know is, if someone says that we can't restore hearing, that means it's not that we can't restore hearing, that means they can't restore hearing. There's a difference.
Keep your expectations balanced. Don't expect miracles, but also know that it will help you. And in some areas it may not. So be prepared for both. Do your research and know yourself what you are getting into first. It's very important. And empower yourself with information. Know what you are getting into. Go for a very good doctor. 60 to 70% is all your effort that goes in, training your implant to process the new sounds. Do not expect that just because you have a surgery now you will be able to hear everything miraculously. That's not going to happen. It is a steady process. So put in your hard work and efforts, and I'm sure it will pay off well.